We want to discuss now the anterior front line. When it becomes shortened in this fashion, okay, we want to lengthen the anterior front line up the front, down the back, the Tom Myers concepts that are great stuff. So we want to open up this front line. But first we have to discuss with the client or patient about breathing. Normally we are shallow breathers. People breathe up here, breathe up here, breathe up here. So we get a lot of scalene activity and other activities up here. Whereas we have to teach the client or patient how to breathe first of all. That's one of the first things I would do in my sessions is discuss their breathing and watch them breathe and see how we can help their breathing pattern. So we need the diaphragm to do its job. Breathing from the belly out, expanding that diaphragm, taking the pressure off of the muscles that are a little higher up, that are more supporters instead of the main prime movers for the breathing in the lungs. So the diaphragm is sort of an umbrella. The diaphragm attaches to the psoas, also quadratus lumborum. So the diaphragm has a lot of muscular components to it, attachment-wise. So what we want to do is we want to have the client breathe out, belly breathing. So now her diaphragm is expanding. She's using her diaphragm, and she's taking away these guys that can get a lot of stress. So breathe out. And during all your exercises, movements, massage, life in general, this is how we should be breathing, through the belly. Diaphragm expands, and the diaphragm contracts. So that's how our breathing pattern should be. So that's one of the first things I'd like to discuss is the little bit deeper aspect of the movement in terms of diaphragm. And again, we're all living in a short world, flexion world, so anything that's short, we kind of want to lengthen. And in this case, usually abs are too short, kyphotic spine posture, we're all short here. So it wouldn't make much sense to massage down. It would make more sense to massage that front line up to release all the tissue, and then we're going to do diaphragm. So to warm up this region, we would like to just do, I call it a wave, gentle. We will bend her knees in a couple seconds. Just get that fascia, get the rectus abdominis, get the fascia on the sides. So we really want to loosen up all the fascia. If they're ticklish, I don't know, maybe she's laughing a little bit, but we want to maybe heal a hand a little bit. Don't be too pokey because that becomes ticklish. So we want to take away those factors. So we really want to warm this region up well. We can bend the knees. Now we want to do a scooping fashion to work the front line upward. So we start the pubic bone or just superior to it. They can massage that region as well, going up if you feel insecure about, you know, privacy issues or things like that. So you're going to be scooping this way up. We don't want to press straight down into the organs and access other things. We really want to stick to the rectus femoris. And we want to get in on the, and she's pretty tender there. The rectus femoris, want to engage it. She's fighting. Remember, the pain scale or the pressure scale is 2 at the most in pressure. You don't want to have the person reflex, which she did, so my pressure was too much. You could also skin roll to get some of the superficial layers in all directions. So we want to engage the tissue, feel it with your fingertips, and we're working that front line. We could work all the way up in through sternalis, this fashion, and up and out. So we're working this way, up, and out, to open up that front line, which is usually short. Pectoralis minor, pec major, biceps, anterior delt. The diaphragm, we're so short. We're all breathing, and these guys are not working to open ourselves up, okay? So we want to work this up in this fashion all the way up and around. We want to engage the diaphragm, so we have the person take their belly breath. We're coming up and under. Exhale, slow. And I just let it sink in. I let their body control my therapy. Her body's in complete control. Watch where your hands go, okay? Modesty factors. So her body's either allowing me in to the region or it's not. In this case, it's taking a little while. For the video purposes, we didn't warm up as much as we should have. Okay, so I follow the breathing. So she inhales through her belly, and then she releases. I kind of come up and under. Monitoring, seeing their eyes, if they're blinking hard or how their body's reacting, because they won't tell you sometimes. You have to use their subtle clues. So we want to work that diaphragm up and under. And then I would come to the other side and work this side. I'd rather not have my arms twisted like this. We can work the costal cartilages as well. Always get into the costal cartilages. So we'll demonstrate this again. So she breathes, and when she exhales, we kind of come up and under, gentle. So again, the whole concept of this is learning how to breathe properly, taking these guys out of the equation. They're supposed to be assisters, not the prime movers in the breathing. We want to work this front line upward because from the pubic bone to the manubrium, we're usually short. And then we want to work the thoracic spine to open that up as well, so we can do things on the front and on the back to get our better posture in the front line, back line relationship. What I would like to discuss now is kyphosis, and we see this a lot in the clinic in everyday population, and we see people walking around like this. So there's two things that we need to discuss, or the two theories and concepts. One is opening that front line. We're opening from the pubic bone up, right, the abdominals, because we're so tight here, so short here, working into the diaphragm, opening up the sternalis into pecs, and we want to open up that front line. But in the process, that's only half of the game. The second half would be closing the facets and closing these thoracic spine, because we're so far this way. We have to do something to open, and we have to do something to close. So we want to stand up like this. So what happens is the spine gets pretty kyphotic or kyphosis here. So what we want to do is do a few techniques. Some of them more broad techniques, and some of them a little bit more specific in between each vertebral segment in the thoracic spine, okay? So what we want to do is locate where the patient or client has the tightness in the abs and the open in the back. So, for example, we'll just say about T6, we'll have the person sit up. We'll find our spot, okay, simulate a little bit. So simulate kyphosis a little bit, right? So we're going to find our spot. So we're going to take the pillow here, put it right in that spot. They're going to lie back into that, and then arms up. And we try to open that one little segment. She just went, kind of felt good. So then we're going to have them sit up again. And then we're going to find the next segment. Up, down. So then we're going to find the next segment. So this is general. You're going to find people who cannot do this whatsoever. Okay, please lie back down. So what happens is something pointier or smaller, like a tiger tail, those tails they do the rolling with, we could use those as well on the ball and things. But I like to start off with a general, wider device to just loosen and open, because what we're trying to do is close this, close this, close this. And in a sense, what we're doing is we're opening all these anterior longitudinal ligaments. We're trying to open this up, open up the front and close the back. So once I warm them up with this and I feel they can move on to the next stage or next breakout, the next one, a little bit more specific, is it might not work for all, but I guess my hands are strong, but I use my finger here. So what I do is I find the segment here, whatever it is, and I put my hand there. So sit up, thank you. So I find it, I put my hand directly there, and then they come down onto it. So I'm like this on that vertebral segment. Okay, then they come up, and then I move to the next one, up and then down. So I find the next one, and that really opens up the anterior. Take it right back down, thank you. So what I'm doing is I'm going from vertebral segment to vertebral segment, trying to open this front and close the back. So it's a two-part theory in a sense. We're going to open the anterior, open this up, right? Going all the way down into the arms, open up, and we want to close this down. And these techniques work really great with people that have been sedentary or sitting, kyphosis, or work, non-ergonomic settings and things like that. Again, following through with the last segment is we want to open up this anterior chest, anterior thorax, abdominals, and close in the back. We did it on the table. Now we're going to do it on the ball. A little bit more challenging for people who are not too stable or mobile for that matter. We experiment with this tiger tail thing. This is primarily used for rolling out and stuff, works great. But it's very hard. So I don't recommend using it as much as my hand or something a little bit more softer. So we're going to try it with this. We did it before the video, and she winced because it's pretty hard against the spinous processes. So it's the same theory. We're going to go in between a vertebral segment that we want to close down, okay? So she's going to slide down onto this, and then at the apex, and it's pretty rigid, okay? Okay, now up. So you can use this device, but I like to use, again, my hand. Some of you are going to say, well, my hands are weak, or my hands hurt, or massaging, whatever the case may be, but the ball gives, the table gives, and you want to get this spot of your hand right in between the spinal segments that you want to release. So let's have you lie back again. And she's pretty balanced. She's an athlete, so she could roll on the ball, and I could open this up this way. Okay, sit up again. Great. So to review, you really need to have them practice rolling back on the ball a few times and how to just get that balance of the ball prior to, as well as that's a great exercise to open up. Just have them lie on the ball backwards, and that opens up the anterior thorax, anterior abs, opens things up, diaphragm, and that capacity before you might engage. But the tiger tail works, but I like my hand a little bit more because that's a little harder. And you know, it seems to work pretty well with the hand and a little bit softer things to close down those joints in the back and then open up that thorax. What we're going to be doing now is more the thoracic evaluation or assessment, and when you find someone who has a lack of the mobility in the thoracic spine. Remember, the thoracic spine is a mobile joint or mobile region. So when you lose that, then we start to get compensations in other areas. So what we're going to do is we're going to test the multi-segmental rotation. So she's going to put her arms and rotate everything to the right. The lower, and I rotate everything to the right. So head included. So as she rotates, she can rotate pretty far, but not quite far enough. So we're going to decide now, is it here where she's losing her rotation or lumbar? So what we're going to do is sit her down and take the lumbar aspect out. So we're going to sit the person down. It should have been 110 degrees of rotation. You should be able to go all the way. If they cannot do that, we need to break it down further to see if it comes from thorax or the lumbar spine. So it's 50 degrees of each, basically. So we're going to have her hold the bar. We sit up straight, nice. We're going to have her rotate. So she's not quite 50. Rotate the head. If I pushed her, I could do that right now. So I'm leaning towards it being a little bit more of a thoracic non-mobility situation. So what we're going to do is we're going to try to gain some thoracic mobility with two movements that we're going to assist with her. So she's going to stand up again. We're going to have her go on a quadruped. So we're going to go fours. You're going to lean back some. You're going to put one arm in front. Straight in line, straight. This is going to be straight. She can put her arm behind her head, nice and back. Now she's going to rotate. We're testing this here, 50 degrees. So a lot of times you've heard me say in the video, the test is the exercise. So this is the test, now it's also the exercise. I'm going to come in here like this. I'm going to assist her, and she's going to rotate to her left, rotate. We're trying to get the thoracic spine to open. Rotate this way. That's number one of movement we could do. We're going to have the person sit tall, tall standing, kneeling like this, tall, tall. Okay, great. Now what we're going to do next is have the person arms behind the head. Clasp them, please. This works great for rotation, getting mobility back. They're going to rotate as far as they can, in neutral position, trying to keep everything straight. It's not easy, so she's going to rotate. Then she's going to go back. Then she's going to neutral again. Find her new, better range, keeping her arms back. Then rotate back again, down. Okay, one more. So she's going to rotate, 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 rotate in the thoracic spine. I feel it shaking a little bit. And then we're going to go back. So you can just put your arms down, and you can stand up if you want. So this is a good way to do the selective functional movement assessment, along with not necessarily massage for massage therapists, but there's ways that we could correct this very easily, and we could test, then we break it down a little further, and then we could do some more assessments on the ground, and then we could do some rotations to gain some mobility in the thoracic spine, along with massage techniques and other things that we do.